Welcome to Ask the Dentist. We were not on in September. We were out doing some additional training on some of the later techniques, and we're ready to serve you. And we're ready to answer your questions today. So if you have questions, call us at 444-6488 or look us up at the website at paducahdental.com and click on Ask the Dentist. Our first question is from Sam from Harrisburg, and he wants to know, what can you do if you have a cracked tooth? What are the options? Well, Sam, if it's a small crack, you can put a filling in it and hopefully that will take care of it. If the crack is larger, then many times you'll have to come in and put a cap on the tooth, and hopefully that will keep it from cracking anymore. If the crack has gone down through the root and you're experiencing problems that way, then most likely you'll have to have the teeth or the tooth extracted. Getting a crack is hard to diagnose. Sometimes people will say they are having problems chewing or biting, and you can't see the crack. So that's something you definitely want to follow up on so you can get it while it's early. Linda from Cape Girardeau has a question. She has a large gap between her two front teeth and wants to know what are her options to take care of the gap. Well, Linda, that's a good question. You know, there are some movie stars out there that they're famous because they have a large gap, but most people want to get rid of the gap. So what do you do if there's a large gap between your two front teeth? Well, one option would be to take tooth-colored filling material, much like if you had a cavity on your tooth, and you take that material and build it up and you kind of close the highway between the two front teeth. That will look good. The long term of it is not quite as good because there's no strength in the filling material. The best option there to close the gap would be to have a cap of a veneer made in a laboratory. And that way you'll close the gap, you'll get the look that you want, but you have the strength where you can confidently chew without it breaking. Good question. One of the new techniques we learned at the continuing education course back in September was we were able to extract a tooth, take a bad tooth out, and place an implant that same day right after we take it out. We measure the root of the tooth, and we take an implant the same size as the root, and we screw it right into the site. So you get it done on the same day. You don't have to come back and have more shots or anything like that. Very promising, and we have done that here at Paducah Dental Care since I've been back. Remember, you have questions, call us at 444-6488.